Welcome to everyone. Myself Dr. Mouneshwari, Associate Professor, working as a Associate Professor in Shree Paripurna Sanatana Ayurveda Medical College, Bangalore. My department is Agata Tantra Department. Today I am presenting the case presentation. The Atura Nama Prasanna, Vaya 34, Linga, male, Vritti, room servicer and Nivasa is the Dharwad. Ward number 184, IP number 03614, OP number 021, Pravesha Tithi 11/6/2023 and Nirgamana Tithi 19/6/2023. Pradhana Vedana, Pidaka all over body, more on both upper and lower limbs, low back and scalp since 8 years back. And Anubandhana Vedana, Daha and Kandu, along with the powdery discharge from the lesions. This is the picturization of the lesion. Next, Vyadhi Vrtanta, patient was said to be apparently healthy 8 years back. Then one day he notices small maculopapular lesions on posterior aspects of left elbow joint associated with itching and gradually developed with scaling and powdery discharge of the skin. He took allopathic medicine but not cured. So he visited our hospital and again he took a treatment on OPD basis and symptoms reduced. Aggravating factor here Snigdha and Guru Ahara during Sita Kala, evening and on exposing to cold. Relieving factor summer season after application of coconut oil. No history of drug allergy, chemicals and animal bite. Now since 10 days the symptoms become severe, so he got admitted in our hospital for better treatment. Purva Vyadhi Vrtanta, history of accident 1 year back on left hand injury. No history of fever and diabetes mellitus and hypertension. Before he was allergic to dust. Vaiktika Vrtanta, here Ahara mixed veg. He wake up on around 6:30 to 6 to 6:30 and taking the tiffin puri, idli, dosa, rice and tea at 7:30. Afternoon around 3 to 3:30 taking the rice, sambar, chapati and non-veg weekly 3 times, and evening tea, and also many times he have a habit of taking the tea. Night chitrana, chapati, sambar and non-veg. Next, appetite, adequate and attain appetite before next meal, takes till satisfaction, bowel regular once a day, no straining while defecation and no any history of the Vegadharana. Maturation here regular 5 to 6 times per day, and at night 1 time, no burning sensation. Sleep, disturbed sleep due to itching, and used to sleep around 10:30 to 1 p.m. and wake up at 6 o'clock. Family history, there is nothing specific. अष्टविध परीक्षा नाड़ी 70 per minute, मला मूत्र normal, जीवा लिप्तता, शब्द प्राकृत, स्पर्श mild rise in temperature, दृक् प्राकृत, आकृति is मध्यमा. दशविध परीक्षा प्रकृति कफवात, विकृति रसरक्त मांस, सार मध्यमा, समान मध्यमा and प्रमाण मध्यमा, सात्म्य मध्यमा. Sattva is avara, abharana shakti, that is ahara shakti, abharana shakti is madhyama, jarana shakti is madhyama, vyayama shakti is madhyama and vaya is madhyama. General examination, build and posture, moderate build. Nutritional assessment, moderate nourishment, pallor present, sinus is absent, icterus is absent, and physique is height 5.3 inch and weight is 53 kg. BMI is 22.64 per kg, and lymphadenopathy, enlargement of lymph nodes absent. Vital sign, respiratory rate 18 per minute, pulse 70 per minute, BP is normal, 110 by 80 mm of Hg, temperature is 98.6 degree Fahrenheit. Systemic examination, cardiovascular system inspection, palpation, percussion and auscultation normal. Central nervous system well oriented, level of consciousness alert, responsive. Mental and emotional state is normal. Respiratory system inspection, palpation, percussion and auscultation all is normal. Per abdomen examination, inspection lesion present, palpation soft, no tenderness, no organomegaly, percussion, no any added sound, auscultation, normal peristaltic sound heard. Skin examination here, in the inspection, number of lesions, Sankhya, area of the distribution, Sarvasharira, size is 6.7 cm on the left elbow joint. Nature of the lesion, maculopapular, surface, kara and ruksha, shape that is irregular, color is reddish, edema absent, temperature mild rise in temperature, discharge absent but some small amount of powdery discharge. Palpation, on palpation sensation is present, Keenakara sparsha, parushata, mild increase in temperature, and candle grease sign positive, ossified sign is positive, nail is pitting of nail. Hair normal, no color change, scalp powdery discharge present. Next, move to the laboratory investigation. HP11, gram percentage. ESR is 8 mm per hour. Lymphocytes 45%. Urine microscopic pus cells 1 to 2. UHG of the abdomen, no any abnormality detected. Nidana Panchaka, Nidana Mityahara, Snigdahara, Guruahara and Anupadesha. Purvarupa not able to that appreciate specific Purvarupa. Rupa reddish lesion with silvery scales later joined together associated with itching, burning sensation, dry and rough. Upa says home food, Anupa says outside food. Next, in general Samprapti Kushta, that is Nidana Parivarjana, Mityahara and Mityavihara, Tridosha Prakopa. Then due to this Tridosha Pakapa, Visated Tvak, Rakta, Mamsa, Lasika and moves throughout Tiraka, Gata, Strotas and prescribe the persistence of the Kushta, that is Kitipa Kushta. Samprapti Gataka, Udbhavasthana Amasaya, Vektasthana Tvak, Sancharasthana, Sarvasharira, Adhisthana, Tvak, Rogamarga, Bhaya Rogam, Agni, Jataragni and Tatavagni, Dosha, Vata, Kapha, Pitta, Dushya, Rasarakta, Mamsa, Lasika, Strotas, Rasavaha, Raktavaha, Mamsava, Svedavaha, Strotadushti Sanga, Vyadi, Avastha, Sa-ama Avastha. Diagnosis of dosha involved here, Vata, Pitta and Kapha, both. Vataja here more Rokshata, Parushata, Kara and Syava Aruna, Pitta Daha and Kapha is Kandu. Next, Vavachadika Nidana, we can differential diagnosis as Kitipa Kushta, Eka Kushta, Charmadala, Sidma Kushta, Vipadika and Alasaka. According to our Acharya Charaka, Kitipa Kushta is considered as a Syava Varnata, Kinaka Spasha and Parusha. According to our Acharya Vagbata, Rukshata, Kinaka Spasha, Parushata, Kandu, Asita and Vata Kafaja. According to our Acharya Shushruta explained here, Sravi, Vritta, inch and weight is 53 kg. BMI is 22.64 per kg. And lymphadenopathy, enlargement of lymph nodes absent. Vital sign, respiratory rate 18 per minute, pulse 70 per minute, BP is normal, 110 by 80 mm of Hg, temperature is 98.6 degree Fahrenheit. Systemic examination, cardiovascular system, inspection, palpation, percussion and auscultation normal. Central nervous system, well oriented, level of consciousness alert, responsive, mental and emotional state is normal. Respiratory system, inspection, palpation, percussion and auscultation all is normal. Per abdomen examination, inspection lesion present, palpation soft, no tenderness, no organomegaly, percussion, no any added sound, auscultation, normal peristaltic sound heard. Skin examination here, in the inspection number of lesions, Asankhya, area of the distribution, Sarvasharira size is 6.7 cm on the left elbow joint. Nature of the lesion, maculopapillar, surface, Kara and Ruksha, shape that is irregular, color is reddish, edema absent, temperature mild rise in temperature, discharge absent but some small amount of powdery discharge. Palpation, on palpation sensation is present, Keenakara Sparsha, Parushata, mild increase in temperature and candle grease sign positive, ossified sign is positive, nail is pitting of nail. Hair normal, no color change, scalp powdery discharge present. Next, move to the laboratory investigation. HP 11 gram percentage, ESR is 8 mm per hour, lymphocytes 45%, urine microscopic pus cells 1 to 2, UHG of the abdomen, no any abnormality detected. Nidana Panchaka, Nidana Mityahara, Snigdahara, Guruahara and Anupadesha. Purvarupa not able to appreciate specific Purvarupa. Rupa reddish lesion with silvery scales later joined together associated with itching, burning sensation, dry and rough. Upa says home food, Anupa says outside food. Next, in general Samprapti Kushta, that is Nidana Parivarjana, Mityahara and Mityavihara, Tridosha Prakopa. Then due to this Tridosha Pakapa, Visated Tvak, Rakta, Mamsa, Lasika and moves throughout Tiraka, Gata, Strotas and prescribe the persistence of the Kushta, that is Kitipa Kushta. Samprapti Gataka, Udbhavasthana Amasaya, Vektasthana Tvak, Sancharasthana, Sarvasharira, Adhisthana, Tvak, Rogamarga, Bhaya Rogam, Agni, Jataragni and Tatavagni, Dosha, Vata, Kapha, Pitta, Dushya, Rasarakta, Mamsa, Lasika, Strotas, Rasavaha, Raktavaha, Mamsava, Svedavaha, Strotadushti Sanga, Vyadi, Avastha, Sa-ama Avastha. Diagnosis of dosha involved here, Vata, Pitta and Kapha, both. Vataja here more Rokshata, Parushata, Kara and Syava Aruna, Pitta Daha and Kapha is Kandu. Next, Vavachadika Nidana, we can differential diagnosis as Kitipa Kushta, Eka Kushta, Charmadala, Sidma Kushta, Vipadika and Alasaka. According to our Acharya Charaka, Kitipa Kushta is considered as a Syava Varnata Kinakara Sparsha and Parusha. According to our Acharya Vagbata, Rukshata Kinakara Sparsha Parushata Kandu Asita and Vata Kafaja. According to our Acharya Shushrita explained here, Sravi, Vrutta, Ghana and Snigdha, Krishna Varna and Pitta involvement of the dosha. Vyadhi Vinishchaya, here we can consider it is a Kitipa Kushta. And Chikista, here 3 days plan for the Virechana. Snehapana with the Kalyanakar Gruta, and next Shunti Jala 30 ml BD, and next after third day is completed, on 4th day we plan for the Abhyanga with the Eshti Madhu Taila and Baspasveda, Anuloma with the 2 HS, and on the 4th day Ushnodaka Pana administered, and along with the Amlaki Churna Sastika Shali Lepa with the Takra, and 5th day again we plan for the Virechana with the Nimbamruta Eranda Taila 40 ml, along with the Triphala Kashaya 50 ml. For this the person attended the 4 Vegas. This is the plan for the Virechana. On the first day Kalyanaka Gruta 30 ml, and second 70 ml, and third day 90 ml. On third day the whatever the symptoms, itching and the dryness reduced. This is the picturization of the skin lesion before treatment. After treatment, this is the lesion reduced. On advice on the discharge, on OPD basis, Mahamanjishtadi Kwata 3 teaspoon TIDV administered, and tablet Gandhaka Rasayana 2 BD and Soralin ointment for external application. It is for 3 days. It is for 3 months routine. And next on the next other 3 months, we plan for the Soralin ointment for external application, and Batola Katuraneti Kashaya 3 teaspoon TID, and Aragyavardhini 1 TID, and Anuloma HS. On the other 3 months we planned, and again on 3rd months we plan for the Patola Katuraneti Kashaya 3 teaspoon TID and Tiktamrita 5 ml before meal, and Bilvadi Gutika 1 BD and Avipattikara Churna 3 gram before tiffin, and Ablaki Churna plus 777 oil under sunlight 20 minutes. Last 3 months course we planned. Total 9 months course it is carried out. Almost this patient condition cured stage. This picturization shows the clear lesions. Next, Chikisa Sutra, Vata Uttareshu Sarpi Vamanam, Sleshma Uttareshu Kushteshu, Pitta Uttareshu Moksho, Raktasya Virechanam Chagre. Means if the person suffer from the Kushta, having with the visation of the Vata dosha, we plan for the medicated ghee internal taking, and if the person suffer from the Kushta, along with the Kapha involvement dosha, the person should have the Vamana Karma. If the person suffer from the Kushta, along with the Pitta visation, we plan for the Virechana and Takta Mokshana. Next, move to the conclusion. As per condition of disorder, if not diagnosed in a better pathway and neglected, means not treated in a time, will leads to secondary disorder. With later stage, it will worsen the condition of disorder as well as health of the patient. By knowing this, B has good knowledge of medical science, then only physician achieve the satisfied success and fame in their medical field. Thank you one and all for giving the opportunity to present here.